Grey's Anatomy is a famous medical drama about Meredith Grey, who is an aspiring surgeon and happens to be the daughter of one of the best surgeons in the world, Dr. Ellis Grey. Together with her colleagues and doctors at Seattle Grace Hospital, Meredith faces both professional and personal obstacles throughout the course of the series. The doctors at Grace Sloan Memorial Hospital face life or death decisions every day. They find solace, friendship, and occasionally more than friendship in one another. Together, they are learning that neither relationships nor medicine can be categorized in black and white. Only grayscales represent reality. The common theme of relationships in this drama is not particularly black and white, and there are a lot of issues that are covered throughout the show, like domestic abuse, inappropriate relationships, and medical errors. Grey's Anatomy gives us insight into how people in the medical community live their day-to-day lives. We see things from patient-to-doctor relationships all the way to doctor-to-doctor relationships. We also see the many hardships that doctors must undergo, like life or death decisions and ethical versus rule decisions. We also have a better look at the effects of COVID-19 and how the medical community had to deal with it all. People that aren't necessarily a part of the medical community still watch the show, and they're able to learn a lot about hospitals. The accuracy of the show isn't perfect, but they do showcase important problems that they have to face every day. I want to explore the problems of having relationships in the workplace. Domestic violence is heavily talked about because of the many cases brought into the hospital. Now, you might be wondering, why is this important? Well, in an article written by Encyclopedia, it states that studies have shown that television competes with other sources of human interaction, such as family, friends, church, and school, in helping young people develop values and form ideas about the world around them. It also influences viewers' attitudes and beliefs about themselves, as well as about people from other social, ethnic, and cultural backgrounds. TV shows and movies take up a lot of people's times nowadays because it is so accessible to watch. Over 230 million users are subscribed to Netflix, where they conveniently have Grey's Anatomy. And that is only on Netflix. A lot of other places also stream Grey's Anatomy, where they have around 4.1 million viewers. Grey's Anatomy covers a lot of difficult topics that most people should be aware of. I covered a lot on the awareness it brings for domestic abuse survivors and cultural differences in America. People who watch Grey's Anatomy can see different views of issues, which gives them a deeper insight into what people have to go through daily. A lot of racial issues are covered in the show. For example, patients who would not let non-white doctors treat them, and the oppression that LGBTQ people face. A lot of instances where children who are part of the LGBTQ community come in and are scared to come out to their parents as transgender, even if it helps them get treated better. A lot of people who live a perfect life sometimes do not see the struggles that most people in America have to go through. Financial issues, racism, and domestic abuse are just some of the major problems that Grey's Anatomy does a great job of explaining and helping educate the watchers. The whole show focuses on the drama just as much as it does on medicine, so exploring these issues would be ideal. If doctors have a sexual relationship with each other and it doesn't end up working out, issues during work will arise. Doctors could be in the middle of surgery, and if they have an issue with their coworker, it takes away their focus from the patient. If patients have a relationship with their doctor and do not tell anyone, this violates all codes because a doctor isn't allowed to do procedures on family or friends. When a relationship or romance does develop between two coworkers, there may be a number of problems. In an article by Screen Rant, it gives an in-depth explanation of workplace choices in Grey's Anatomy. It tells us specific times when events that happen in the show are a little questionable. Being close to your partner during or after a disagreement might be difficult. Just picture how challenging it would be to compromise with your partner in a conflict. Conflicts in a partnership could result in punishments or, worse yet, the dismissal of one or both individuals. Most people who are dating each other at work confront this as one of their main obstacles. If someone has a short fuse or finds it difficult to resolve relationship issues, they might want to avoid dating a coworker. If the doctor leverages or abuses the trust, information, feelings, or power gained from the prior professional relationship, or if a romantic relationship will otherwise avoidably hurt the person, then it is unethical to engage in sexual or romantic relationships with former patients. A doctor who has cause to suspect that non-sexual, non-clinical interactions with the patient may be construed or may result in romantic or sexual contact with the patient should avoid such contact in accordance with their ethical duty to refrain from inappropriate behavior. Issues like these in Grey's Anatomy are not talked about enough, considering in almost every single episode you see doctors dating each other, or in other cases patients dating their doctors. The portrayal of the U.S. healthcare system in Grey's Anatomy is controversially either similar or different. According to the article written by Molly Thomas, many praise the episode for what they called an accurate, in-depth depiction of how a rape kit is administered. Perhaps the most moving scene of the episode, however, came towards the end when Abby is being wheeled into the operating room for surgery. The hallways are lined with women, many in scrubs and some in ordinary clothes, standing in silent solidarity and support for Abby. This scene was very powerful and very real. In the medical community, they experience many cases of domestic violence, and when treating their patients, they want to be kind and make them feel seen in this horrible world. However, with 17 seasons under their belts, there are bound to be some inaccuracies. Many doctors have come out and said that the doctors on the show do not use the instruments correctly in surgery and do not follow the exact precautions when scrubbing in for surgeries. My thesis is the show Grey's Anatomy appears to show drama and inappropriate relationships in the workplace. However, real-world problems are accurate and they tell the audience a deeper story about the medical industry. If anyone has any questions, feel free to ask. And one question I have is, does my thesis have enough tension?